Alright, welcome to From Behind the Nurse's Station. Of course, like I've said in my previous videos, my name is Ethan, and I'm a registered nurse, have my bachelor's degree, been working on a master's degree for nurse practitioner. One thing I wanted to do, I like teaching people, and it's part of my job. So when a patient comes into the hospital and I have to explain to them a new diagnosis, what it means, and how it's going to change some of the aspects of their life, that's one of my favorite parts. And so something that keeps coming up in my mind that I want to talk about is atrial fibrillation. A lot of people live with atrial fibrillation. A lot of people end up going into it and coming out of it. That'll make more sense here in a few minutes when I explain some things. Now, I have a model of the heart here, and I will go through a brief overview of the anatomy of the heart. This heart here actually sits a little bit sideways in your chest. It doesn't sit flat like this like a lot of people think it does. It actually sits kind of off to the side this way. So that's the way it's oriented in your chest, kind of sideways like this. Alright, now a lot of you know that you have the aorta that comes up, the aortic arch, and then you have arteries that come up, and you have the left and the carotid arteries that come up, and you have ones that go to the brain, and then you have arteries that come off of these, and it comes down and comes around the back of the heart, the circumflex, and you have one that comes down the left side of the heart, that's the left anterior, and you have one that comes down the right side of the heart. Now, you have 4 chambers in your heart. You have 2 up top and 2 down bottom. The one on tops are called atria, and the ones on bottom are called ventricles. Now, the right side of the heart, on the top, this is where the superior and inferior vena cava come in, and they empty into this atria right here, the right atria. And from this atria, it's squeezed down into the right ventricle. So it comes down to here. From the right ventricle will contract and squeeze and push the blood up through the pulmonary artery here, which has deoxygenated blood because it comes back from the rest of the body and comes into the heart here, comes up through the pulmonary artery, pushes out to the lungs on either side, gets the oxygen, and brings it back through the pulmonary veins that come in on the side. They come in over here and then through the back here. Alright, so when it comes back from the lungs, it comes into the left atria over here on the left side of the heart. And from the left atria will squeeze and the blood will go down into the left ventricle. From the left ventricle, it'll be pushed up through the aorta here, through the valve, through the aorta, and out to the rest of the body. Okay, now, atrial fibrillation, talking about the atria. What happens with atrial fibrillation is these 2 atria do not contract and squeeze and push the blood into the ventricles like they should. Instead, they kind of quiver. And so when they quiver, the blood just kind of trickles down, mainly through gravity. So you lose about 30% of the push that's really pushing the blood down into the ventricles to get it out to the rest of the body and into the lungs. Now what happens is when blood just kind of trickles out, it kind of pools in these atria. Now, the dangerous thing about that is when blood pools, it clots. And those clots, when they do pass, if they pass, they will go down to the ventricle, and then they will be pushed out either to the lungs, or they can be pushed out to the brain, they can be pushed out around the heart, they can be pushed out to other parts of the body, and it can cause a clot in other arteries. Now, that itself can cause a pulmonary embolism, can cause stroke, can cause heart attack, can cause other blockages in the arteries and the veins. So, one thing with atrial fibrillation is you're going to be on a blood thinner, maybe for the rest of your life. Now, it depends. Not everybody stays in atrial fibrillation. Whenever you have atrial fibrillation, you may or may not have symptoms. Symptoms such as lightheadedness, dizziness, heart palpitations. You'll have an irregular heartbeat because you have a pacer node in the right atria that sends a signal out to the rest of them that tells it when to beat. Now, when you have atrial fibrillation, these are not in sync. They may fire off a lot of different signals telling the heart to contract. Now, since that's what causes the quivering, because it has so many signals that are just being fired all over the place. Because each cell can act as a pacer cell on its own, but they don't sync together when they're in atrial fibrillation. So they just kind of quiver and everything's firing. And so the ventricles will contract at irregular times. So you have an irregular heart rate, you may feel palpitations with it. Now, Coumadin will help to thin the blood to prevent it from clotting here in the atria, and then those clots getting pushed down here, so it'll help prevent that and make you less likely for that to happen. Now, I'll put links below to websites, creditable websites, not Wikipedia or some .com or something like that. It'll probably be like a government website or something from a university, where they've done studies and things like that, and that actually has information about all this also, as well as for Coumadin, and probably the manufacturer's site for Coumadin. Now, Coumadin is a blood thinner that they typically use for atrial fibrillation. There are other blood thinners that they may have you on, like aspirin. If you have some stents put in from other things that are, maybe I'll explain in another video, you'll be on Plavix or Pradaxa or something like that. So, now, with atrial fibrillation, if it's causing those symptoms I was talking about, like the lightheadedness, shortness of breath, palpitations, low blood pressure, things like that, the doctor may want to resync your heart. So they may want to defibrillate your heart, which they would do some conscious sedation and kind of put you in, a little bit out of it, and then they'll shock your heart and see if that puts it back into rhythm. If it doesn't, and if your heart rate goes too low and it stays there and you're having those symptoms, they may want to put in a pacemaker or a pacemaker and defibrillator, which will keep your heart at least at a certain rate to wherever they set it, maybe 55 or 60 beats a minute, maybe 70 beats a minute, depending on the individual. Now, with Coumadin that they use to treat it a lot of the times, you have to watch your diet as far as like vitamin K. If you eat a lot of salads and green leafy vegetables and things, it doesn't mean that you can't eat those still. It means that you need to keep a consistent amount in your diet. So you don't want to be increasing or decreasing the amount of the green leafy vegetables and the foods containing vitamin K that you normally would, because that can change your blood levels. They'll check your blood levels to see how thin they are, the PTINR. Now, when you first start on it, they'll check it fairly frequently to get the right dose to keep you at a therapeutic level, which is usually between 2 and 3. Now, once they get to that therapeutic level, then they may only have to check it, once every couple weeks or so. It depends on your doctor and what they feel comfortable with. Your cardiologist will probably be the one to manage that. You'll have a cardiologist, of course, because of the cardiac-specific issues. Your family practitioner may keep an eye on things, but you want to report to your cardiologist on a regular basis, like every 6 months or every year or so, depending on you as an individual and how you're dealing with things and what other health issues you may have going on. So that is some of the basics about atrial fibrillation. Now, as far as causes, there are primary causes, which are basically kind of unknown causes, and then there are secondary, which is caused by something else, like cardiomyopathy or coronary arteries disease or hypertension. Some of the primary causes may be like pneumonia can cause it, or any number of things, and that's something that will be in the links down below. Hopefully that was a little bit informative for you. Let me know if you have any questions about it, or if there's another topic that you want me to talk about, and I will work on posting a video for that.